Hi, I'm Dr. Felice Gersh. Welcome to my Instagram live show. All this month, September, PCOS Awareness Month, I am telling the story of what it means to be a woman with PCOS. So, you've probably been following me, but if you haven't, I just want to let you know that all of my shows are archived on my YouTube channel. So, for those of you who have never met me before, let me just first introduce myself. I am a bit of a rare breed. I'm an integrative OBGYN doctor. I have a practice in Irvine, California. That's in Southern California, where I see patients every day, Monday through Friday in my office. And I'm a little late today because I got tied up on the phone with a patient who had a need. So my priority is always my patients. But after them, then comes you. Of course, we won't talk about my family. Of course, they are hugely important in my life. But I think of every woman with PCOS as also part of my family because I was it was one of the first times in my life, really, that I've actually brought myself and my story into the picture because I am a PCOS woman, just like so many of you out there. I also want to make sure that you know, I'm going to grab it here, that this is my first book on PCOS, the sort of foundation book, PCOS SOS, that I wrote with my daughter, Alexis. And I have to tell you that through the entire month of September, it's available in the Kindle version for only 99 cents on Amazon. As well, the other book, our second book, PCOS SOS Fertility Fast Track, is also available for only 99 cents on Amazon. So anyone who wants it can easily access it and for close to nothing. So today we're going to talk about a problem that unfortunately is not fun and games. It's not funny at all. It's about mood problems, anxiety, depression in women with PCOS. This is a multifactorial problem and very prevalent in this group of women. So why is that? Well, I said it's multifactorial. For one thing, 80% of women with PCOS suffer with weight resistance. It's very difficult for them to lose weight. And it's very frustrating. How frustrating can it be? Every day you struggle. Women with PCOS also have higher rates of eating disorders, particularly binge eating disorder. And I'll explain why that is. But that creates so much inner turmoil when you just want to be good. You don't want to eat things like a bag of chips or cookies or something, but they keep calling you out, like calling your name and come and eat me, and you become obsessed until you finally eat all that food that you didn't want. I wouldn't even want to call some of it food. It's not good. It has no, but the definition of food means that it has nutritional value, and a lot of this stuff does not. But you can't think, you can't function until you just go and eat it. It's a true obsession. And then, of course, you have self-hate, loathing. That is not good for anybody's mood. There are other things that happen in women with PCOS that also feed anxiety and depression. Many women suffer from signs and symptoms of androgen excess. That means that their bodies have too much of hormones that are male hormone type. Males and females have the same hormones, but in very different ratios. So women have 10 times more estrogen, men 10 times more testosterone. But women with PCOS tend to run high levels compared to average women, not the levels of a man, but high levels for a woman of testosterone and also often of the adrenal androgen, dehydroepiandrosterone sulfate, known as DHEAS. When you have excessive amounts of androgens, it can lead to excessive facial hair. So we call it hirsutism. So women often shave every morning and get a 5 o'clock shadow, or they just get all these stray hairs. And it can also be excessive hair on their chest, on their abdomen, and furry legs and furry arms beyond what would be typical, even hair on their backs when it's extreme. As well, recalcitrant, stubborn, cystic acne is also common in women with PCOS, and what we call alopecia, androgenic alopecia, where you lose hair in a male sort of pattern of baldness around the temples, right in here, coming up in this area, and also often around the whole head, and not typically just on the crown, not here, but around here, and then just general head. And their hair gets finer and finer, and then finally, after a hair falls out, the whole follicle of hair, the hair follicle, closes down, and that hair will never grow back. These are things that no woman wants to deal with, and of course they lead to depression. You get up in the morning and you look in the mirror, you have to shave, you have more acne that you're desperately trying to cover up, and the conventional medical therapies often do not work. And then you have to do things with your hair to try to cover up the fine areas and the areas that may have no hair even. These are things that cause great emotional upheaval in women with PCOS. And then there's more. Women with PCOS have very high rates of sleep apnea. So they often do not get adequate amounts of sleep. They have pauses in their breathing at night due to alterations from a couple of things. They have the breathing centers in the brain may be malfunctioning, sending the wrong signals to breathe. And often due to weight gain, there's actually a thickening around the neck, which can cause the tongue to fall back and block the airway. So for a number of reasons, sleep apnea is quite high in women with PCOS. So they have disturbed sleep. When you do not get enough sleep, there are so many studies that show the dramatic negative impact on mood. Women in this situation inherently with sleep deprivation have serious problems with anxiety and depression. And then it turns out women with PCOS often have what I call a flipped circadian rhythm. You are supposed to have high levels of cortisol in the morning and low levels in the evening. And the opposite is true for melatonin. But unfortunately, in women with PCOS, due to circadian rhythm dysfunction, which we can talk more about, that is the unbelievable evolutionary alignment of every living creature on planet Earth with our rotation, our 24-hour rotation of our planet Earth on its axis, so that every creature is either a day creature, diurnal, or a night creature, nocturnal. We are diurnal. We are day creatures. But when you have a flipped circadian rhythm, it's like you're living in a time zone that's exactly 12 hours different from yours. Like it's noon where you are, but your body feels more like midnight. When that happens, you have this alteration in your cortisol being produced, as I mentioned. And at night, when you should be revving up for sleep, and you're revving up your melatonin and downing your cortisol, it's the opposite. Your cortisol is actually rising, which makes you feel more alert. So you label yourself a night owl, and then you stay up too late. And then on top of that, as I mentioned, you may have sleep apnea. So you get poor sleep. You get poor quality sleep, and you don't get enough hours of sleep. That leads to emotional problems, anxiety and depression, and lots of mood swings. Now, what else can lead to these problems? A disturbed gut. So women with PCOS have been discovered to have a dysbiotic gut microbiome. That means the microbes that live in their GI tract are not right. It turns out that we have what is called a gut-brain axis. This is a bidirectional relationship between the gut microbes and the functioning of our brains. And this linkage between our gut and our brain is through the short chain fatty acids. Those are the metabolites, the fermentation products of the bacteria fermenting the fibers in our diet, creating these metabolic products called short-chain fatty acids. One of them in particular, called butyrate, actually combine to what is our vagus nerve. The vagus nerve is very critical for emotional health. The vagus nerve is like a big finger of the brain that comes down. It's not part of the spinal cord, and it has branches that go throughout the body, to the heart, to the skin, to every single part of the intestinal tract. And the bladder, like pretty much everything, has a little branch that comes from the vagus nerve. The vagus nerve contains the portion of the autonomic, that's like the automatic nervous system, that's called the parasympathetic branch of the autonomic nervous system. It controls many of the automatic functions of the gut, like the peristalsis that keeps your food moving properly along. It also, in the brain, controls calming and feeling peaceful. In the heart, it also calms the heart, so it's not beating too rapidly and it beats nice and regularly. And what we call heart rate variability is increased when you activate the parasympathetic nervous system through stimulation or activation of the vagus nerve. This is what happens when you have the right microbes and the right diet. You make these wonderful short-chain fatty acids like butyrate, which bind to receptors on the vagus nerve, activating more parasympathetic tone, making you calmer, happier. In addition, women with PCOS have a higher level of cortisol because of their chronic state of low-grade inflammation. Cortisol also dysregulates the gut and the gut microbiome. So you can see how this is like a real spiral, sometimes a spiraling out of control. Because when you have a lot of cortisol, it activates the sympathetic branch of the autonomic nervous system, which makes you have the stress reaction. So your heartbeat goes up, you feel anxious, worried, you're sweaty, clammy, nauseated, you want to pee and poop, and throw up, okay? That's when you have too much sympathetic activation. Now, when all of these are in beautiful balance, your body works great. You're supposed to have both, like the yin yang of Chinese. You want to have some sympathetic and some parasympathetic. You don't want all of one or the other. And in women with PCOS, they tend to have way too much sympathetic and not enough parasympathetic. That leads to a chronic state of anxiety or upregulated sympathetic tone. And this is related to a multitude of factors, including, as I said, the dysbiotic gut microbiome. That's why there's a whole new branch of psychiatry called nutritional psychiatry, recognizing that you need to have a healthy gut to have a healthy brain. And then there's more. There's nutritional deficiencies that many people have, but they may be magnified in women with PCOS because of inflammation in the gut. They may not have proper digestion and absorption of nutrients. One of the most important nutrients for being calm and sleeping well is magnesium, one of my favorite minerals. It activates over 600 functions in the body, including the production of neurotransmitters like serotonin, the neurotransmitter that makes you feel happy and peaceful. And from serotonin comes the neurotransmitter melatonin that has a multitude of functions in the body beyond just helping you to sleep, but including helping you to sleep. Melatonin also has receptors on the ovaries, and that is so important for regulating a woman's menstrual cycles. And women with PCOS often have very irregular, sporadic ovulation. So they have very irregular menstrual cycles. Their production of hormones is off from the ovaries. And one of the big deal things in women with PCOS is a reduced production and a reduced functionality of the receptors for the ovarian hormone estradiol. That's the form of estrogen that comes from ovaries. So why does this matter? It matters hugely because estradiol is actually anxiolytic. What does that mean? It means it reduces anxiety. Yes, estrogen from our ovaries makes us calmer and happier. And it probably does this through a couple of mechanisms. One, there are neurons in our brain called serotonin neurons that make the neurotransmitter serotonin. They are dependent on estrogen for functioning. So you need to have estrogen to make an adequate amount of serotonin. The brain makes estrogen. That's how men get it. But women with PCOS, their brains don't make enough, and women in general make far, far less estrogen in their brains because they get it from their ovaries. That's one reason, by the way, why after menopause, there's a dramatic increase in mood disorders in women, often not talked about, because they don't have enough estrogen, estradiol in their brains. Women with PCOS have deficient amounts of estradiol in their brains. Now, another mechanism that causes estradiol to be anxiolytic, reduce anxiety, is through its complex relationship with another signaling system, a lipid fat signaling system called the endocannabinoid system. These are lipid signaling agents that work to help us through many, many functions in the body, including mood regulation and immune regulation. There are receptors for the endocannabinoid system throughout the brain, throughout all the organs, and also very, very importantly, on immune cells. As I mentioned, women with PCOS tend to be chronically inflamed, and part of that involves the endocannabinoid system. It turns out that estradiol increases the amount of an endocannabinoid called anandamide in the brain. Anandamide is the natural endocannabinoid that is comparable to THC, which is in marijuana. Now, marijuana is a plant, right? But it happens to have a component called THC that can bind to our own endocannabinoid receptors for anandamide. And I mentioned this, I'm not encouraging you to use marijuana, not at all. That I'm not into that as a recommendation. But I wanted you to understand this because a lot of people haven't heard of the endocannabinoid system, but they have heard of cannabis. Cannabis was named, and then guess what? After they figured out that cannabis worked on humans, they didn't know how, they discovered our endocannabinoid system. And that name came from cannabis. The name cannabis came before the endocannabinoid name. So endo means from within. And cannabis means our own receptors for our own naturally made cannabis-like signaling agents from lipids that bind. And this is important because a lot of people know that if people smoke or consume marijuana or cannabis, that it makes them feel calmer. Now, like I said, I am not recommending this at all. I just want you to understand what's going on in women with PCOS, that they have a deficiency of our own natural endocannabinoid, anandamide, because of a deficiency of estradiol. And these endocannabinoids in our brains make us feel calmer and help us to sleep. And on our immune system, they help. And there's more than one endocannabinoid. It's a very complex system in that there are what we call friends of the endocannabinoids. The 2-AG and the anandamide are the two main endocannabinoids, and then I call it endocannabinoid friends. And there's a whole group of lipid signaling agents that are friends of them that work in this whole complex system, which we're not going to delve into right now. But the takeaway is that estradiol is an intimate part of the endocannabinoid system, which is all about our mood and about inflammation. And that is a big deal. So, what can we do? Now you know women, for a whole variety of reasons who have PCOS, tend to have problems with anxiety and depression. So what are we going to do? Well, we want to start with the gut. The gut is so important for having a healthy gut-brain axis so that our brain will be getting the proper signals from the short-chain fatty acids like butyrate through the vagus nerve and directly to the brain. By the way, the butyrate can actually travel into the brain through the circulation and make the brain feel happier. It's fatty acid. It's actually food as well. And it also is food for the lining cells that are called the enterocytes of the gut as well. So we have to nurture our gut microbiome. This is so important. You have to eat the right foods. You have to eat lots of plant-based foods, beans, lentils, root vegetables, all the colors of the rainbow. If you have trouble initially, start small, work your way into it. You may have the wrong gut microbiome for eating the healthiest foods because you've adapted your microbiome to bad foods, but that's bad for you, right? Just because they're used to eating garbage doesn't mean it's making you healthier. It's making you unhealthier. So work your way up into a very high plant-based diet with lots and lots of fiber to nourish the gut microbiome. And we're going to talk more in detail about the best diet for women with PCOS. And I have to speak in general terms because everyone's unique. But we talk about the average woman with PCOS. So you got to nurture your gut microbiome to have a healthy brain and happiness. What else? You have to sleep. Sleep is not optional for having a really good mood. So darken the room. Make sure you use a sleep mask like me if necessary. Get into what we call preparation for sleep plan. We call it sleep hygiene. Trying at least an hour and then work your way up if you can to even 3 hours to not use screens. So you can read, but you have to use a paper book. You can listen to music. You can write paper letters. You can listen to wonderful podcasts. You can have conversation. Just please don't get bombarded by the blue light of screens. If you must, for whatever the reason, then get blue light blocking amber glasses and get all the apps on all your devices to reduce the blue light exposure, please. Use some calming, like essential oils. You don't have to become an expert. If you're not sure, you can always go with a little bit of lavender. Just rub a little bit into the bottoms of your feet. You can get a hydrosol, that's the water portion of the essential oil, and spray it on your hair, on your body. It's lovely. If you have trouble falling asleep, take a really hot bath or shower and then get really sweaty, quickly wipe off, and then jump into bed. It's been shown, and have a fan on blowing cool air at you. It's been shown that going from really hot into your bed will actually promote falling asleep. Please stop eating early and have a big breakfast. That will help work with your circadian rhythm to get it back on track. Stop eating by 7 p.m., at least 3 hours, no matter what, before you go to bed. You can have some calming teas, like chamomile tea is a wonderful one, lemon balm, passion flower. Have it at least an hour before you go to bed. If you feel like you need some, I recommend very small doses of melatonin to help you sleep, like 0.5 milligram a couple of hours before you go to bed, and then maybe 1 milligram about half an hour before you go to bed. Sometimes we go higher, but these are recommendations that would apply to everyone. Watch the sunset. The colors help to lower your cortisol. Make sure you get a mind-body practice like guided imagery or meditation. Work with a hypnotherapist. These will help you to be calmer, to upregulate your parasympathetic pathways so you will be calmer and happier. Have body work, massage, like craniosacral massage. Work out the knots, the fibrosis in your fascia, which is so common in women with PCOS. Have a face massage, a head and neck massage. These are wonderful. Do it on a regular basis. If you'd like to, find a therapist and do cognitive behavioral therapy. Think about biofeedback. In my office, we teach biofeedback. It's guided meditation with biofeedback that looks at heart rate variability, which is looking at your parasympathetic tone. So you can actually see how doing meditation, listening to beautiful sounds and soft voices and telling you how to imagine things, how it really increases parasympathetic tone, calming you, making you feel happier. There are so many of these wonderful things that you can do. And I almost left this one out. Exercise. Exercise is calming. It works in studies better than antidepressants, which notice I did not mention. If someone is suicidal, you must seek professional help right away. And there can certainly be a place for prescription drugs in someone who is in that state. So please, if you are ever suicidal, immediately call 911. Tell someone, anyone, and make sure you get immediate help. Assuming that that is not your situation, then there's not a reason that you should have to be on pharmaceuticals, which have so many side effects we know now. There are natural ways. And there are some herbals as well. Ashwagandha. It's an adrenal adaptogen. If you are too low, it'll make you higher. If you're all wired, it'll make you calmer. Another one of my favorites is bacopa, another Indian Ayurvedic type of herb. It's for anxiety. L-theanine, which is a derivative of green tea, also helps people sleep and is very calming. And there are others, but you don't have to memorize all of them. If you know just these, and then having the herbal teas like passion flower, lemon balm, these are wonderful and calming. Try Tulsi, also known as holy basil tea. These are fantastic. And there are more herbs, but this is for beginners. Let's just start with these. This is plenty. And like I mentioned, essential oils. Lavender is perfect for beginners. There are others. One of my favorites for depression is bergamot. That is from a lovely Mediterranean citrus plant, a citrus fruit. It's a plant that has a fruit called bergamot. You can often get bergamot in Earl Grey tea. Sip it around 3 o'clock in the afternoon. Put your feet up and listen to some beautiful music. Maybe take a nature walk afterwards. And you can get bergamot essential oil. I recommend putting it on a handkerchief, putting it in a Ziploc bag, and whenever you're feeling a little blue, just take a few sniffs. It turns out that when you use your olfactory center in your brain and you stimulate it with these wonderful essential oil scents, it goes right to what's called the limbic center of your brain that makes you immediately feel happier and calmer and more at peace with the world. So women with PCOS, yes, they have more challenges with mood, more depression, more anxiety, and we understand why, and we also know how to help them. So thank you for joining me today for this really important conversation about PCOS, anxiety, and depression. I'll be back again in the very near future for the next installment of the story, Women with PCOS. And remember, you can get my 2 PCOS SOS books on Amazon for only 99 cents for the Kindle version. And if you do, and you feel so inspired, of course, I would love a review. Thank you so much. Stay well. Stay happy. Bye.